I'm Dr. Joel Cohen. I'm the director of AboutSkin Dermatology in metropolitan Denver, a world's leading clinic. And today I'm going to speak to you about heavy laser resurfacing. So laser resurfacing is what we use for severe etched lines and wrinkles. Many people call it the barcode on the upper lip. It can be crinkles and wrinkles and lines underneath the eyes. And we use the big guns. We use significant lasers that have downtime to treat these conditions. About me, I enjoy writing. So I've published at this point 327 articles, and I've written or co-authored 3 academic hardcover textbooks. A lot of my writing and a lot of what I lecture on is heavy laser resurfacing. So usually somewhere in the US, often 2 to 3 times a month, I'm giving lectures on pearls and pitfalls of heavy resurfacing, and then usually about once a quarter somewhere international as well. What is ablative resurfacing? Ablative resurfacing is using a laser like a CO2 or an erbium laser to resurface the skin, meaning it actually interacts with the tissue in the skin and vaporizes some of the tissue. So it induces and causes bleeding and weeping, and it takes a while to recover, but the changes that happen in the skin are transformative. What does ablative resurfacing treat? Ablative resurfacing we use for severe etched lines and wrinkles. We use it for acne scars as well as now laxity. So fractional ablative resurfacing was the invention of a really pioneering dermatologist at Wellman Institute of Photomedicine in Boston. So this is a program at MIT and Harvard, and his name is Rox Anderson. I interviewed him on one of the webinars that I host, and he was the one who really came up with the concept of treating the skin in fractions. So you're literally either poking holes with non-ablative lasers or you're vaporizing holes with ablative lasers that creates that wound. So the wound weeping is like oozing and seeing some of that serum. You're able to see major changes in the skin each time you do these treatments. What's important with heavy laser resurfacing is to make sure to choose a physician and a facility that actually does these procedures on a regular basis. So we have a system every day at 11 o'clock and 4 o'clock. We see these patients, we prep these patients, we explain to them what they're going to experience. We try to keep them comfortable during the whole process, particularly the process of anesthetizing their skin and making sure they understand what to expect during the treatment and after the treatment. And I like to see people after the treatment every few days to make sure they're actually healing pretty well, and we answer their questions. One of the newer innovations with ablative resurfacing is something called laser-enabled tissue coring or laser coring. So we can use lasers on full field, so we're resurfacing 100% of the skin. We can do fractional, where we're actually poking holes and vaporizing these holes in certain percentages of skin. And then laser-enabled tissue coring is when we're vaporizing larger holes in these fractional holes. So in particular, if somebody has an area of laxity in what we call the secondary smile lines here, or the accordion lines, we can use those settings to actually help shrink some of the skin. And over a course of a couple treatment sessions, it can be very significant in terms of the amount of improvement. One of the great things about laser-enabled tissue coring is that you're doing this coring with the laser. So you're already seeing the benefit of the laser in terms of lines, in terms of pigment, luminosity, and overall appearance of the skin. And at the same time, you can see these changes in the laxity from the coring. So when you look at photos, you don't really have to convince patients that some of these areas of laxity are that much better. You're showing patients what globally looks better because the lines and the wrinkles and the pigment and overall light reflection look better as well. So what does recovery and downtime look like? I really try to get a sense for each patient's downtime. So somebody may actually be concerned about going back to work, and we might do the treatment on a Friday so that they have the benefit of having 2 weekends to re-epithelialize, which means to heal over. And that's really important. So I make sure that they have all the instructions that are written down. We demonstrate the instructions. We show them some pictures of what to expect. And they're also seeing before and after pictures, so they understand what's going to happen along the way and then what hopefully they're going to look like when we finish the process. I have a great 6-day sequence that really shows that point and that transition from from bleeding and weeping and that oozing kind of serum to really just that oozing and then redness in the area and then just pink. And I'm one of the boards for one of the topical sunscreen companies. And as a board member, we all present things regularly. And I showed that sequence of photos. And I said, what I consider downtime is the point where patients and the time frame patients are at home, where they're washing and cleaning. But what they consider downtime is until they actually look presentable to go back to work. And a lot of times patients are concerned about that, what we call post-inflammatory redness. So I was the one who suggested the green tinted version of that sunscreen. And I did the only clinical trial on that process. And now we all enjoy this sunscreen because we know that green camouflages red on the color wheel. So with Elta as the company that made that sunscreen, I got to go with them to the New York Stock Exchange and help ring the closing bell and talk about some of that data. Heavy laser resurfacing is really one of my favorite procedures to perform. Patients know that there has been significant improvement. We don't have to walk over to the standardized camera system and look line by line. Patients come in, they give me a thumbs up and they say, I'm seeing major improvement. And a lot of times people do this before a very significant social event in their family. So their daughter's wedding or their niece's wedding, and they plan ahead, and really we want to see them during the process and make sure that they're healing well, that they're covering up some of that post-treatment redness, and that everything looks good. And sometimes it's a series of treatments as well. And if you want to learn more about heavy laser resurfacing, visit worldsleadingclinics.com.